because you need alcohol. Because So what I did was same thing. I took resveratrol, I took hyaluronan, and I conjugated. So this is hydrophobic. This molecule is hydrophilic. So the overall molecule is water soluble. So if you can inject this, and then in Dr. An, we're talking about snorting it, so we can get to the brain. So, this is a thin aircraft. It tells you this is resveratrol, this is hyaluronan resveratrol mixture. There's no conjugation. This is our conjugation. We increase the molecular weight, so it should not move up. And then once you burn this, hyaluronan is sugar, it caramelizes. So this is hyaluronan resveratrol mixture, and this is the hyaluronan resveratrol conjugation. So we know that we're successfully conjugated. Next slide is very boring. It's all molecular. It's all chemistry. It's all chemistry stuff that verifies that we successfully conjugated the resveratrol to the backbone of hyaluronan. This is the latest result. We did this last week. Gal and I. We did this last week. So this is two different neuroblastoma. One kidney blastoma. If we expose it, if we treat them to hyaluronan, this is the titration dosage we get. However, if we treat them hyaluronan resveratrol, they quickly die. We have to repeat this. We are in the process of repeating it. Look how responsive these neuroblastoma is to hyaluronan resveratrol. So the IC50 is around 1 micromolar. So we just have to get it to the brain. So we're going to order the CD44 antibodies to see if how well these cells express the CD44 receptor. If they do, we're continuing. We're going to repeat these results to make sure we verify it. And then after we repeat these results, this may not be the true IC50, but these neuroblastomas seem to be very, very responsive to the hyaluronan resveratrol.
It means that resveratrol is very toxic for the cancer cell.
If it is in solution. If it's in solution. So, as I said, if you take resveratrol, there's a famous case study, Dr. An, I should teach this in class. There was a company, there was two scientists that realized the benefits of resveratrol. So they found a method of producing high-yield, high-quality resveratrol, and they basically want to say, I want to put this in a pill and give it to all the people in the world. They did that. It didn't work because they forgot basic chemistry 101. Resveratrol is not soluble in water. You'll be surprised how many times that I talk to people who develop drugs, and my first question is it soluble in water? And they say, no. Then how are you going to get it to patients? If you give it IV, it's not going to go through their blood system. You have to be water soluble. So you need a strategy of getting your drug water soluble, either nanoparticles or conjugation. Yes?
And if you attach your molecule,
yes,
therapeutic molecule,
yes,
on the polymer backbone,
yes,
and then carry to the target.
Okay, long as it has a carboxylic acid or an alcohol group, I can conjugate to hyaluronan.
And my question is it decomposed into the medicine?
Oh, that's a good question.
In itself, and once it is decomposed, it is dissolved.
Okay, that's a good. Thank you for asking the question. So how does? Remember, this molecule is now about a 1 million molecular weight. So, thankfully, our body has a lot of enzyme that degrades hyaluronan. The hyaluronidase throughout our circulatory system. So what I believe was going on, as soon as we inject this into the body, even in cell culture media that should be hyaluronidase, is degrading the hyaluronan chain so that the drug can be liberated. However, we hypothesize, we need to test this. Come on. So this bond is breaking. However, we think this molecule is a prodrug form, but it does not affect the efficacy of the resveratrol.
But if it is not totally decomposed into the original form of the molecule,
Yes.
drug molecule,
Yeah.
then the efficacy of the medicine
It could be reduced.
They can be dubious.
Yes, I understand that. But for resveratrol, the active site is here, this double bond. We're down here.
Really?
Yeah. So long as it can get to the right site, we think the drug is still active.
My opinion is that it
Yeah.
should be confirmed by the clinical.
I would love to give this thing to clinical.
So just by insisting on the effective point that is here is
Yeah.
not. I think that's not very.
I understand that.
Yeah.
I understand that, but
persuasible.
yeah, but in order to get this to the market, I have to raise probably $10 million to get the GMP protocol. At the GMP protocol, then there's actual clinical trial, and it's not for efficacy, it's for safety. At least in the United States, phase 1 is safety. Then you do phase 2, phase 3. So if you know an investor, I would love to talk to him.
If so, anyway, it will be better to drink a soda mixed with the regular.
Yes, absolutely.
Especially the Andong soju is better.
Okay. Why?
Because it contains more alcohol to solubilize that molecule.
Oh,
Yeah.
okay.
Wow. Right.
왜 그러죠? 저 퓨어하고
지금 말씀하시는 게 그게 저 몰레큘이 하이드로포빅하기 때문에 물 몸에 들어가면 몸에는 물이 있기 때문에 코agulation은 이펙티브하지 않은데 저 이펙티브하기 위해서는 사실은 솔벤트에 녹여야 되는데 그거는 저기 아까
Up here. So hyaluron resveratrol, and I think the reason why is that cancer cells overexpress CD44, just like folic acid receptors. So there's a lot less CD44 in fibroblasts than cancer cells.
If so, there is no reason why